taking you by the hand and put you on the bus. You can't think for yourselves. All you do is blabber around Obama.
When in the last 235 years has the United States government owned
the powers not delegated to the United States by the Constitution nor prohibited by it to the states are reserved to the states respectively or to the people. That is your 10th Amendment. That is your 10th Amendment. You have no right to government health care.
What's your name and where you're from?
My name's Paula Torres, Windham, New Hampshire.
Okay, and what brought you out today to be here?
For my freedoms, my liberties, it's my freedom of speech. Healthcare is not the way to go. Healthcare reform is not the way to go right now. Not this form.
Is this your first time doing something like this?
We did a tea party back in April.
Yeah.
I've never really been into politics. First 6 months of my life.
Right.
The last 6 months of my life, that's the first time I've really been into it. But I feel my liberties are fading away.
And you are?
I'm Ann from Holderness, New Hampshire.
Yeah.
And I'm, like you said, an average citizen that wants their voice heard. I'm not going to get out of anybody's way, and I'm not going to shut up. This is not what I want. This is not what a lot of people want, this healthcare reform. And that's why I'm here today.
And have you been active in politics before? Or?
Well, always. I vote every time. So in that way I'm active. But in the last, I always have my lawn signs every election. But this is the first time where I've actually come out. Well, I actually did the tea parties back in April, and now we're doing this.
Okay, very good. What's your name and where are you from?
Pam Kelly, I'm from Nottingham, New Hampshire. I really care about health care for everybody. I don't think only the wealthy and the privileged and the employed, now that we have so much unemployment, should get health care. And I don't think that employers should be responsible for health care. We should all be responsible for health care together.
And have you been active in politics before, or is this a new thing coming out?
Brand new.
And what made you decide today's the day you're going to come out here?
Because it's Portsmouth and it's close to me, and I'm retired, so I now have time to do this.
Can I get your name?
Christy.
Okay, and where are you from?
I'm from Dover.
Okay, and what brought you out today?
Well, part of the reason why I'm here is to advocate for prevention and treatment for people with substance abuse and recovery. Have that included in the new healthcare reform.
Have you been involved in these type of events before? Is this a new thing for you?
Not really. I work for a nonprofit called Friends of Recovery New Hampshire, so where we advocate for people that are in recovery.
And you thought this was a good opportunity for the president maybe to see your sign and get the word out?
Absolutely.
And I am proud that on this side, we're not spewing hate and lies. I'm proud of that.
Because I'm going to be seeing you on campus, baby. Yes, we're going to take that fight to the campus too.
No words about we see in this book, folks. What were they thinking? What were they thinking?
You're chanting Obama, but he just sold you out going down to Mexico.
Well, it's 1, 2, 3. What did we fight in Vietnam for? Be out here and speak our word.
Don't you have a proven you? We're not in the business of buying car manufacturers. We're not in the business of buying tanks. We are patriots that support for all Americans.
Go back to Cuba!
Hey! Ask the Cubans how their health care is working for us.
Yes, we can! I'll give you the free attack!
6 months ago, we were I want you to remember what things were like in January and February. We were losing about 700,000 jobs per month. And economists of all stripes feared a second coming of the Great Depression. That was only 6 months ago. That's why we acted as fast as we could to pass a Recovery Act that would stop the free fall. And I want to make sure everybody understands what we did. 1/3 of the money in the Recovery Act went to tax cuts that have already started showing up in the paychecks of about 500,000 working families in New Hampshire. We also cut taxes for small businesses on the investments that they make. And over 300 New Hampshire small businesses have qualified for new loans backed by the Recovery Act. Now, that was a third of the Recovery Act. Another third of the money in the Recovery Act is for emergency relief for folks who've borne the brunt of this recession. So we've extended unemployment benefits for 20,000 New Hampshire residents. We've made health insurance 65% cheaper for families who rely on COBRA while they're looking for work. And for states that were facing historic budget shortfalls, we provided assistance that has saved the jobs of tens of thousands of workers who provided essential services, like teachers, police officers. So it's prevented a lot of painful cuts in the state, but also a lot of painful state and local tax increases. Now, the last third of the Recovery Act is for investments that are already putting people back to work. These are jobs refurbishing bridges and pavement on I-95, or jobs at the community health centers here in Portsmouth that will be able to add nurses and extend hours and serve up to 500 new patients. These are good jobs doing the work America needs done. And by the way, most of the work is being done by private, local businesses, because that's how we're going to grow this economy again. So there is no doubt that the Recovery Act has helped put the brakes on this recession. We just saw last Friday, the job picture is beginning to turn. We're starting to see signs that business investment is coming back. But New Hampshire, that doesn't mean we're out of the woods, and you know that. It doesn't mean we can just sit back and do nothing while so many families are still struggling. You can keep your health care plan. You will not be waiting in any lines. This is not about putting the government in charge of your health insurance. I don't believe anyone should be in charge of your health insurance decisions but you and your doctor. I don't think government bureaucrats should be meddling, but I also don't think insurance company bureaucrats should be meddling. We just heard from Lori about how she can't find an insurance company that will cover her because of her medical condition. She's not alone. A recent report actually shows that in the past 3 years, over 12 million Americans were discriminated against by insurance companies because of a pre-existing condition. Either the insurance company refused to cover the person, or they dropped their coverage when they got sick and they needed it most, or they refused to cover a specific illness or condition, or they charged higher premiums and out-of-pocket costs. No one holds these companies accountable for these practices. And I have to say, this is personal for Lori, but it's also personal for me. I talked about this when I was campaigning up here in New Hampshire. I will never forget my own mother, as she fought cancer in her final months, having to worry about whether her insurance would refuse to pay for her treatment. And by the way, this was because the insurance company was arguing that somehow she should have known that she had cancer when she took her new job, even though it hadn't been diagnosed yet. So if it could happen to her, it could happen to any one of us. And I've heard from so many Americans who have the same words. One woman testified that an insurance company would not cover her internal organs because of an accident she had when she was 5 years old. Think about that. I think that there are some of my Republican friends on Capitol Hill who are sincerely trying to figure out if they can find a health care bill that works. Chuck Grassley of Iowa, Mike Enzi of Wyoming, Olympia Snow from Maine. Yeah, I gotta admit, I like Olympia too. They are diligently working to see if they can come up with a plan that could get both Republican and Democratic support. But I have to tell you, when I listen to folks like Lori and families all across America who are just getting pounded by the current healthcare system, and when I look at the federal budget and realize that if we don't control costs on healthcare, there is no way for us to close the budget deficit. It will just keep on skyrocketing. When I look at those two things, I say we have to get it done. And my hope is we can do it in a bipartisan fashion, but the most important thing is getting it done for the American people. This young lady right here. All right, this young lady right here. She's still enjoying her summer. When do you go back to school?
I go back to school September 3rd.
September 3rd, okay. What's your name?
Julia Hall from Malden, Massachusetts.
Nice to meet you, Julia.
As I was walking in, I saw a lot of signs outside saying mean things about reform in healthcare. How do kids know what is true, and why do people want a new system that can help more of us?
Well, I've seen some of those signs. Let me just be specific about some things that I've been hearing lately that we just need to dispose of. The rumor that's been circulating a lot lately is this idea that somehow the House of Representatives voted for death panels that will basically pull the plug on Grandma because we've decided that it's too expensive to let her live anymore. And there are some variations on this theme. It turns out that I guess this arose out of a provision in one of the House bills that allowed Medicare to reimburse people for consultations about end-of-life care, setting up living wills, the availability of hospice, etc. So the intention of the members of Congress was to give people more information so that they could handle issues of end-of-life care when they're ready on their own terms. It wasn't forcing anybody to do anything.
Good morning. Good afternoon, Mr. President. Bill Anderson from San Martin, New Hampshire. In reference to what you just said, I'm presently under the New Hampshire Medicaid system, and I have to take a drug called Lipitor. When I got onto this program, they said, no, we're not going to cover Lipitor, even though I've been on that pill for probably 10 years, based on the information that my doctor feels is right for me. And I had to go through 2 different trials of other kind of drugs before it was finally deemed that I was able to go back on the Lipitor through the New Hampshire Medicaid system. So here it is, the Medicaid that you guys are administering, and you're telling me that it's good, but in essence, I'm dealing with the same thing that you're telling me the insurance companies are doing.
Well, look, I think that's a legitimate point. I don't know all the details. But it sounds to me like they were probably trying to have you take a generic as opposed to a brand name. Is that right?
That is correct.
And it turned out that you did not have as good of a reaction under the generic as the brand name, and then they put you back on the brand name. Is that what happened?
Correct.
Well,
It's the same money.
right. Look, there may be, in 9 out of 10 cases, the generic might work as well or better than the brand name. And we don't want to just subsidize the drug companies if you've got one that works just as well as another. The important thing about the story that you just told me is that once it was determined that in fact you needed the brand name, you were able to get the brand name. Now, I want to be absolutely clear here. There are going to be instances where if there is really strong scientific evidence that the generic and the brand name work just as well, and the brand name costs twice as much, that the taxpayer should try to get the best deal possible, as long as, if it turns out that the generic doesn't work as well, you're able to get the brand name.
My name is Michael Leon. I'm from Derry, New Hampshire, District 1 in the Congressional District. I'm one of the people that turned myself in on the White House webpage the other day for being a skeptic of this bill.
Before you answer this question, just because you referred to it, can I just say this is another example of how the media ends up just completely distorting what's taking place. What we've said is that if you get an email from somebody that says, for example, Obamacare is creating a death panel, forward us the email and we will answer the question that's raised in the email. Suddenly, on some of these news outlets, this is being portrayed as Obama collecting an enemies list. Come on, guys. Here I am trying to be responsive to questions that are being raised out there. And I just want to be clear.
My question is for you, and I know in the White House, the stand which you're on has often been referred to as the bully pulpit. Why have you not used the bully pulpit to chastise Congress for having two systems of health care? One for all of us and one for them.
First of all, if we don't have health care reform, the gap between what Congress gets and what ordinary Americans get will continue to be as wide as it is right now. And you are absolutely right. I don't think Carol or Paul would deny they've got a pretty good deal. They've got a pretty good deal. I mean, the fact is that they are part, by the way, I want you to know though, their deal is no better than the janitor who cleans their offices, because they are part of a federal healthcare employee plan. It is a huge pool. So you've got millions of people who are part of the pool, which means they've got enormous leverage with the insurance companies, right? So they can negotiate the same way that a big Fortune 500 company can negotiate, and that drives down their costs. They get a better deal. Now what happens is, those members of Congress, and when I was a senator, same situation, I could, at the beginning of the year, look at a menu of a variety of different healthcare options. Most of them offer, these are all private plans, or they could be non-for-profit, Blue Cross Blue Shield or Aetna or what have you. They would have these plans that were offered, and we would then select what plan worked best for us. But there were certain requirements. If you wanted to sell insurance to federal employees, there were certain things you had to do. You had to cover certain illnesses. You couldn't exclude for pre-existing conditions. I mean, there were a lot of rules that had been negotiated by the federal government for those workers. Now, guess what? That's exactly what we want to do with healthcare reform. We want to make sure that you are getting that same kind of option. That's what the health exchange is all about, is that you, just like a member of Congress, can go and choose the plan that's right for you.